What can we say about this section of tissue? I think instantly from our broad experience now, we can see that it's a lung. I think we can see that there are plenty of wide open alveolar spaces here. I think we could appreciate a nice, uniform, thin, fibrous pleural surface. And if we looked very closely at this, we'd probably see some mesothelial cells lining this visceral pleura too, wouldn't we? I think we can see blood vessels and bronchi and the fact that most of this lung is aerating. If you were to feel this lung with your finger, even with your eyes closed, you would say it feels nice and airy and spongy. However, microscopically, let's take a look at areas like this, little lumpy areas, aren't they? Like here, like here, like here. What are these? Well, let's go a little bit closer and see if we could figure out what they are. They are nice little focal collections of inflammatory cells, looking very much chiefly like macrophages, and in some cases the macrophages are fusing to form multinucleated cells. These cells are larger than normal because of their fused cytoplasmic mass, so we can certainly call them giant cells. We can also see that there's a little peripheral cuff and some admixture with lymphocytes as well. We could, by all criteria, very, very safely call these granulomas. We can also say that these granulomas do not appear to have any necrosis. In other words, they are non-caseating. So I think we could say that this lung, in all honesty, is stippled with non-caseating granulomas. Could they be TB? Could they be fungus? Could they be sarcoid? Sure, they could be any of this. But the classical picture for sarcoidosis would look something like this, because in some of the other fungal and TB diseases, the granulomas would be expected to become a little bit necrotic in the center. Classically, sarcoid is non-caseating granulomas. Of course, it's not limited to the lung, and the granulomas of sarcoid could be in many places. But this is a classical sarcoid granuloma. You can see the epithelioid histiocytes, or macrophages, if you will. You can see the fact that they are coalescing to form giant cells. You can see some sprinkling of lymphocytes. This is non-caseating granulomatous disease of lung, which in most cases turns out to be sarcoidosis, a granulomatous disease still of very obscure etiology, found in young women, 20s, 30s, especially of African American heritage. Thank you very much.